And in some other news, health workers battling the deadly Ebola outbreak in Democratic Republic of Congo and neighboring Uganda. They're now facing challenges on multiple fronts fighting the virus, while also dealing with fear, stigma and insecurity in affected communities. While healthcare workers are working around the clock to care for patients while facing infection risks. Several of them have contracted the virus and at least one medical worker has lost their life.
We get a little stressed sometimes. It's not easy to touch a patient who could infect us at any moment. But we made the decision to do this job because we took an oath to do so. We're here for the patients and we're dedicated to that. We encourage Ebola patients to come to the Ebola treatment center.
Now, according to Africa's Centers for Disease Control and Prevention, the outbreak has resulted in more than 894 confirmed cases and over 200 deaths across eastern Congo and Uganda in just over a month. Health officials warn that there could be as many as 35,000 potential contacts linked to the outbreak, but fewer than 15% have been traced so far. Health experts say that mistrust, displacement and ongoing violence in eastern Congo, they have complicated efforts to contain the disease. Cross-border movement between Congo and neighboring countries. It also raises concerns about further spread.
So security situation, big challenge in North Kivu, preventing us from moving ahead with strengthening the response in this area. And our worry was keep delaying of having a humanitarian corridor and access for the responders. When we are going later on for those areas, we'll be surprised with maybe surge of cases happening in this area.
In India's Kerala, a 52-year-old woman who recently traveled from South Sudan has been hospitalized with suspected symptoms of Ebola. Her samples have been collected and sent for laboratory investigation. Now, the outbreak is caused by the rare Bundibugyo strain of Ebola, for which there are currently no approved vaccines or treatments. Among the leading vaccine candidates are projects being developed by the University of Oxford, the Serum Institute of India, Moderna, and researchers working with the World Health Organization. Some experimental vaccines could enter early-stage human trials within months. Now, during the closing press conference at the G7 summit, French President Emmanuel Macron, he detailed measures taken to contain the Ebola outbreak and declared the G7 will dedicate more than $1 billion to the emergency response.
We have also adopted a declaration in response to the Ebola outbreak. Beyond the G7 countries, this declaration was also supported by India, Egypt, South Korea, and Kenya. On Ebola, the message of support is clear: to help the DRC, Uganda, and all territories that could be affected in order to face the epidemic. This requires the rapid development of a vaccine, effective treatment, and the implementation of appropriate procedures in line with WHO standards. Through this declaration, the G7 has committed to dedicating more than $1 billion to the emergency response.